My name is Dr. Allan Spiegel. I'm a neurologist practicing in Florida for 35 years, and for the last 20 years practicing hyperbaric medicine. I learned about hyperbaric medicine about 21 years ago when my mother had had a stroke. She was weak in the left arm and leg, had speech difficulty, and she had gone through physical therapy, occupational therapy, and without significant improvement regarding the weakness in her arm and leg. She could ambulate, but not very far. As a neurologist, we were taught that however a patient is 6 months after a stroke is unfortunately the way they will be for the rest of their life. But after 2 solid years of the same weakness of the arm and leg on the left, I ventured into finding other methods of treating stroke, and I came across hyperbaric oxygen therapy. I initially went to a facility where they were treating patients with stroke with hyperbaric therapy, and I was amazed that patients 5 and 8 years out who were hemiplegic, in other words, they could not move an arm or leg on one entire side of the body, went from being wheelchair bound to ambulating after as many as 20 to 40 treatments. When a patient has a stroke, and what some people don't understand, a stroke is quite frequently is when a blood vessel is closed off by a plaque or a blood clot, or maybe sometimes a blood vessel is ruptured and you have blood leaking into the brain tissue itself. There is an area of brain tissue that unfortunately is irreparably damaged. We're not expecting to resurrect the dead tissue. However, there's an area around the dead tissue called the penumbra. Penumbra is what we call sleeping, dormant, idle brain cells. Now these are brain cells that are getting some ambient circulation, getting some nutrition, getting some oxygen, but not to the same magnitude as it had been prior to the stroke. What hyperbaric oxygen therapy does is it increases the circulation to the area around the stroke. And if you can give nutrition and give oxygen to those regions, you can potentially wake up those sleeping, dormant, idle brain cells. Now, if those areas are in the motor cortex, the part of the brain that controls your motor functions, or the sensory cortex, or the speech center, you can turn back on the part of the brain that was shut off by the stroke. And once we improve that, the symptoms remain intact. In other words, it's not you have to get treated and then it gets better and you have to come back for further treatment. The benefit of hyperbaric therapy is whatever benefits you get to keep. That means for the rest of your life. That doesn't mean for a month or a year, it means for the rest of your life. You can't get any other therapy that will give you this kind of results except for hyperbaric therapy. Let me explain to you what hyperbaric therapy is. You and I are breathing room air, which is 21% oxygen. When we're treating someone with hyperbaric therapy, we are having them lie on a table enclosed in clear glass, breathing 100% oxygen under increased pressure. That causes your body to be infused with anywhere from 8 to 10 times more oxygen than is currently present in the body. That turns oxygen into a drug. Oxygen as a drug does several things. Number one, causes new blood vessels to grow into any part of the body, meaning the head in this case. Number two, reduces swelling inflammation, also we see with stroke. Improves the immune system, which we all need. Helps lay down the framework for healing. In other words, the white blood cells that search out foreign bodies, bacteria, infection, and toxins makes that work better, as well as allows the white blood cells to heal the area in question. It also causes your body to release 8 times more stem cells from the bone marrows and fat stores, causing another means of improving the healing process in someone with a stroke. Many times patients have been seen by numerous other clinicians prior to us, and they're told that, look, your stroke was severe or was even mild, and there's nothing else we can do for you. You've undergone therapies and you have not improved, and look, Mrs. Jones, you're gonna have to learn to live with it. Do not learn to live with it. We can make a difference. We've been successful in over 75% of the patients we treat with stroke have a dramatic improvement. Another 15% have a good response, and 10% have some response. It's not worth living the rest of your life without the exposure to hyperbaric therapy, which could be life-changing. And as I said, the improvement lasts a lifetime.